What should you suspect and how should you manage her? It's a two-step question.
Okay.
A 34-week pregnant patient has painless, bright red vaginal bleeding. So right away, I'm thinking placenta previa.
Okay, we're thinking placenta previa. Is that what you think? If find me an answer.
I would say B. However, now I'm second guessing it because she's 34 weeks.
Okay. So when does placenta previa typically occur?
I thought it was sometime in the second trimester.
It's typically a later term. She's in her third trimester. That can very well happen.
Okay, I thought it was earlier. Maybe it's not. I mean, I know like painless would be previa, so I'm kind of like that's what I was thinking.
And so that's kind of the main way we want to approach this one. So in this situation, would we expect it to be a ruptured ectopic at 34 weeks?
No.
Okay, so I'm going to probably eliminate an ectopic pregnancy because I expect that to happen in the first term. Okay, now the fact that she's having now I don't really worry about the color, bright red, dark red. I don't really care about that. I'm looking for things like painless or painful vaginal bleeding. Now, I would
Yeah.
probably need to if I keep reading this, I'm going to get another clue that's probably going to support placenta previa. And that clue
Okay.
is going to be okay, this has happened once before during her pregnancy. So she could have had some bleeding recently. Like she could have had more bleeding earlier, but in this case, I'm probably thinking more of a the fact that it's painless. I'm kind of leaning more toward placenta previa versus an abruption, and in that case,
Right.
I'm probably going to go with that, and I'm going to answer the question based on that. Because even if I read the rest of it, I mean, I'm still going to probably get to the same answer. So,
Yeah.
all right, now what would make it more likely to be an abruption?
It's usually painful
Okay. Typically, painful bleeding. Both of
and
them can
heavier
be
bleeding.
vaginal bleeding. And I'm not worried about the color because the color can change as the blood gets oxidized, as clots form, stuff like that. Okay. That's how I would approach that question. Let's go to another one.